These are the happy faces of children from Salima district after each of them had received a set of dental care tools courtesy of Teethsavers Malawi. The Teethsavers Malawi has been in the forefront to champion oral health care in districts like Lilongwe and Doha. The development is coming against the background of a serious shortage of oral health workers in Malawi, which has resulted in poor access to oral health care.
The number of service providers, trained personnel in Malawi for oral health are very few. The population mainly lives in the rural area. That means there are a lot of people in the rural area who have no access to any kind of service.
Realizing the serious shortfall of oral health workers in the country, Teethsavers Malawi has embarked on an initiative to train and orient teachers on oral health care so that the teachers will in turn pass the same to their learners.
We had a training to teachers across the country, that is on all the three regions of the country of Malawi, that is Blantyre, Lilongwe and Mzuzu, where 525 teachers, primary school teachers, were trained so that they can help in disseminating the oral health messages to the pupils in their schools.
Teethsavers Malawi has expanded to Salima district, where on average the organization is reaching out to over 3,000 learners per month with oral hygiene messages, screening and oral health care.
On average, we make sure that we have to see at least 3,000 children per month. These children must be taught, they must be screened and treat those with problems. When I'm saying problems, anything to do with the mouth, cavities, the holes on the teeth, as well as the gum diseases.
Having benefited from the initiative by Teethsavers Malawi, Salima as a district acknowledges the positive impact of the preventive approach in improving oral health rather than the curative approach where only a few benefit and after damage has already been done.
Very thankful to the coming of Teethsavers International here in Salima because they are helping us in reaching out to rural masses where we cannot manage considering the human resource that we have here in Salima. Most of the time the intervention that we give is basically curative, and then the coming in of Teethsavers International is helping us much in prevention.
Panova, Parilani, Pano, Pola, no Maseva. Uri Samasa, and Tsega Ledega, the Magana Guru in Angamakumu. Mano, the Mavarula, Kisamario. Amazuka, and when some of Zagio, Guru Dineo, for Mayo, or so the summer leveling. But in the Mayuanga, then I. They are now Magana, they are now Jirma Kisaka. So Vala, Jaguja,
Teethsavers International, a Christian humanitarian organization from the United States, opened its doors in the country in 2009. The organization has been traveling to different parts of the country, conducting outreach programs on good health practices. A delegation from Teethsavers International from the United States of America was in Malawi recently on a tour on some of the projects to appreciate for themselves the work that is going on the ground. Teethsavers has so far visited schools, orphanages and community-based organizations where children from 6 years and above are targeted. The parents too are not spared with lessons on good oral health in partnership with dental therapists from Ministry of Health. The president of Teethsavers International, Jean Day, says he is impressed with the progress that has been made since the organization came to Malawi in 2009.
Within the last 2 years, as I've seen our team grow spiritually, I've seen the country transform spiritually. I've seen great change within the administration. I've seen great change within the people. I've seen the Lord's blessing on the people of Malawi. I've seen the Lord's blessing on Teethsavers International too. Where do I think Teethsavers' future lies? I see Teethsavers as being a valuable asset to the country of Malawi. I think Teethsavers provides a tremendous amount of education health care and encouragement to all the people of Malawi, but especially the children we treat.
Teethsavers International Malawi has partnered with Ministry of Education and Colgate Palmolive Malawi in this noble cause. There are less than 500 oral health workers in the country against a population of over 17 million people. In order to achieve its mission, Teethsavers Malawi is also working with community workers.
Teethsavers, through the means of health and education, has penetrated so loosely because the community is able to understand the need of what we are doing to the children and the community at large. But besides, we face a number of challenges. Challenges such as the people that we reach out are so distantly placed that some areas are impassable. You will discover that during the rain season, our only track may not be able to pass in certain areas where there is so much need of the team to go and do the job. The other challenge could be something to do with the lodging. You will discover that as we go in the field, we don't have facilities to enable the team to be accommodated in an area where they could just move and come back to see the children in the field, then come back. Hence, we camp in schools and in some schools, and most of the schools that are rural-based, you will discover that the environment is not conducive for human habitation.
In view of the commendable job that the organization is doing, Country Director for Teethsavers Malawi appeals for support from well-wishers in order for the organization to reach out further to more people who otherwise have no access to dental care. He says, among other things, the organization needs toothbrushes, toothpaste, and a four-wheel drive vehicle to reach out to hard-to-reach areas.
I think Teethsavers is the most wonderful thing that I've ever been around for reaching out to children that really have a problem with health care and that affects the rest of their health. It's just some of the things that we've seen out in these rural areas. It just breaks my heart to know, that they don't have what they need to brush their teeth and to take care of their teeth. And the resources are so limited, and Teethsavers brings those resources plus the education about how to use those to them, which affects their overall being. And I'm just very blessed to be a part of it.
Kwa beba lero, kuchipala kwa beba